There's no doubt that we are closely watching what happens with the federal budget. Um, you know, Obviously, Medicaid is a joint federal state program, but the majority of the funding comes from the federal government. The base rules are set by the federal government, and then states can get waivers around those to be creative and innovative. But again, since most of the funding comes from the federal government, that's the driver of a lot of what we're able to do. We're closely watching what's happening in DC, but it's hard to tell where things are going to land because we're hearing every different story and every different set of wishes from the people in charge. Right? We've heard leaders, including the president himself, say we're not touching Medicaid. Right? We've heard folks in the House say they're not touching Medicaid. In the Senate, governors are universally saying don't touch Medicaid, but they're still moving forward with reconciliation language that will have them needing to take $880 million or so dollars out of the $1 billion out of the Medicaid system over the next 10 years. And when you're talking about billions and billions of dollars, something has to give. The ability to take it from other places is minimal. And so we really are paying attention to what they come up with. I think a lot of what they've talked about is fraud, waste, and abuse, which I'm all for. We're all for. These programs are critical for folks, but as good stewards of the public dollars, we have to watch sort of what we're doing and what we're spending. But the definitions of waste, fraud, and abuse, I think, are different for different people. We believe that people getting the care they need is critical to the success of the program, and others see basic services as abuse or unnecessary, so they call them waste. They see efforts to expand upstream or to do more innovative, creative things that aren't within the base scope of the original ideas of Medicaid as somehow wasteful. And those are the things that we worry about. We also are paying closest attention to what may happen with the federal match rates that the federal government has for the states. Oregon has a pretty healthy federal match rate, and even more, like all states, for the expansion population, with 90% at the federal level. Cuts to those rates could be devastating to the income the states get to provide the services. And so that's really where we're keeping an eye on. The good thing, and where I feel privileged, is that I work in Oregon doing Medicaid. Oregon has, for decades now, under the leadership of Governor John Kitzhaber in the past and current governors, Tina Kotek right now, said, we believe in our people. We believe in building communities and in having healthy people in communities. And we're going to do things that might be a little different in order to reach our goals of healthier communities for everyone. And we get creative on ways to serve people. We have used state funds very effectively and judiciously to expand programs and to fund creative programs. We've got companies like CareOregon who use our reserves to reach out into communities to go upstream and to amplify the funding that comes from the state and the feds. So, it is daunting, it is challenging, and there will be changes that need to be made. But, again, we believe in the mission of what we do. I think Oregon is a compassionate, creative, innovative state that cares about its people. And, whatever happens, we'll make do. I do think that those are easier targets because at their face, they don't have the direct correlation of patient and provider, right? That many people think is the entirety of healthcare, and that's not, right? Most of the spend that our country has in healthcare is due to reasons that have nothing to do with immediate physical condition or behavioral health condition and things that we would pay doctors or hospitals for. It comes from greater societal pressures on people, environmental factors. So I worry about new benefits that Oregon has recently put in place for climate change, for example. It may not seem as if it's important to use government funds to buy someone an air conditioner. But if they have a health condition in which, through forest fires and smoke events, that they cannot breathe and they end up in an emergency room and 3 days in the hospital, that seems like a worse use of dollars than spending $180 for an air conditioner that will let them breathe throughout the event, right? So climate change events, we worry about getting clawback on those. Food and nutrition programs, we really feel those might have a better chance of surviving because of Robert Kennedy and the MAHA. Those are actually positive things that we see coming out of all this. But a lot of the work that we're doing that goes above and beyond housing programs, education programs, community enrichment programs, family support programs, those are the ones that we worry about most, and being on the chopping block or getting additional scrutiny, particularly when a lot of those programs are rooted in the idea of health equity. Right? I think health equity simply means everyone having the same opportunity for quality health care, regardless of their circumstances or gender identity or race or ethnicity or language spoken or geography. And if we can't address those issues directly, then we really aren't serving people as they need to be served. And so I think the combination of going after social determinants of health that they find, outside of the bounds, or pulling back or forcing the pullback on equity issues, those could be really even more devastating than the basic budget cuts, which are easier to manage.